Diabetes affects millions worldwide. Let's understand the endocrine system and how it controls blood sugar. Hormones are chemical messengers released by glands into the blood. Quick overview first. The endocrine system is a network of glands that regulate metabolism, growth, reproduction, and more. In the brain, the hypothalamus and pituitary control many other glands. The thyroid manages metabolism, parathyroids control calcium balance, adrenals handle stress hormones like cortisol and adrenaline. The pancreas is central to blood glucose control. Gonads manage reproduction. The pineal regulates sleep. Inside the pancreas are alpha and beta cells that secrete key hormones. Beta cells release insulin to lower blood glucose by moving sugar into cells. Alpha cells release glucagon to raise blood sugar by releasing stored glucose. When insulin and glucagon are out of balance, blood sugar regulation fails. Diabetes results. There are two main types. Type 1, loss of insulin production. Type 2, insulin resistance. Briefly, type 1 is absolute deficiency. Type 2 is resistance and progressive beta cell failure. Type 1 is usually autoimmune with genetic risk and environmental triggers destroying beta cells. It leads to absolute insulin deficiency and requires insulin replacement. Treatment is lifelong insulin, pens or pumps. Type 2 is linked to obesity, inactivity, and genetics. Cells stop responding well to insulin. Over time, beta cells may fail, worsening hyperglycemia. It's a progressive metabolic disease influenced by lifestyle and genes. Common symptoms include frequent urination and increased thirst, also increased hunger, fatigue, and unexplained weight loss in type 1. Blurred vision and slow-healing infections are red flags. Long-term microvascular damage includes retinopathy and nephropathy. Neuropathy and diabetic foot problems are common and serious. Macrovascular risks include heart disease and stroke. Management begins with lifestyle, diet, exercise, and weight loss. Aim for at least 150 minutes a week of moderate aerobic activity plus resistance work. Losing 5 to 10% of body weight improves insulin sensitivity. Self-monitoring of blood glucose helps guide treatment decisions. Education on foot care and recognizing hypo and hyperglycemia is essential. Behavioral support, stress control, quitting smoking, and moderating alcohol matters. Type 1 management is insulin-based. Basal bolus regimens or pumps are standard. Adjuncts like pramlintide are used sometimes to improve control. Proper dosing and monitoring are critical. Type 2 has many drug classes. First line is often metformin, a biguanide that lowers liver glucose. Sulfonylureas increase insulin secretion, but carry hypoglycemia risk. DPP-4 inhibitors boost the incretin effect to support insulin release. SGLT2 inhibitors cause glucose loss in urine and can help with heart and kidney outcomes. GLP-1 agonists increase insulin, reduce appetite, and aid weight loss. TZDs improve insulin sensitivity in tissues. When oral agents aren't enough, insulin therapy, basal or basal bolus, is used for type 2 as well. In short, lower liver output, increase secretion, increase excretion, improve sensitivity, or replace insulin. Medication choice is individualized by risks, benefits, and comorbidities. Practical steps: healthy eating, regular activity, weight control, regular testing and care. Work closely with your healthcare team to tailor a plan. Remember the 5 pillars: diet, exercise, monitoring, medications, and support. Know how to recognize and treat hypoglycemia. Keep emergency glucose or glucagon accessible. Seek urgent care for severe symptoms like loss of consciousness or very high sugars with illness. This video is informational. Consult your clinician for individualized guidance. With the right knowledge and care, diabetes can be managed. Learn more and take action today.